Hi, and welcome to the Sparkstart TA Leader Series, where we talk to senior leaders across industries and organizations to see what they're thinking, what they're working on, and what kinds of things are important to them. Today, I'm thrilled to have Jeannie join us from Central Health. Jeannie, would you introduce yourself, please?
Yes, hi. Thank you so much for having me. Appreciate the opportunity to have a discussion. My name is Jeannie Virden, and I am the Chief People Officer for Central Health. We're located in Austin, Texas, and Central Health is our doing business as name, but we're really the Travis County Healthcare District. So our mission is to serve and provide healthcare to the uninsured and underserved residents of Travis County or Austin, Texas. So delighted to be here today to have a discussion.
Great, great, thank you. And I suspect you've got a little bit of a double whammy where you are in the healthcare industry, which isn't exactly awash in excess candidates right now.
That's right.
And because you're serving underserved communities, you're probably not paying top dollar. I suspect you're not funded as well as some of perhaps your private or more prestigious organizations. Is that fair to say?
That is fair to say. I do feel like we try to be as fair and as competitive as possible, but certainly when you are competing with larger health systems, there's definitely a gap in which we cannot always fill.
Right. And given that, you clearly have a need to keep the organization staffed for health reasons. And one of the things that you and I have talked about just recently is some of the artificial barriers that can get in the way of really connecting with top talent. How are you thinking about that? How are you approaching that? Because you're in a highly regulated industry, right? Nurses need to have certifications, so you haven't got a ton of wiggle room. So how are you thinking about this?
No, you're exactly right. So, I mean, and for those positions, you are right. We have to have the proper certifications, we have to have the proper credentials, and we are all on board with that. I think that if we're going to talk specifically about nursing, I think within our workforce, we have an opportunity to provide continuing education and development opportunities to them so that they can learn different areas of nursing. And then they have the mobility within the system to be able to go and flex, if you will, and support different areas of interest that they would like to do. So that's, one small snippet of how we can support someone who has credentials. But, there are so many support positions, right, that people forget that are in healthcare. We always talk about the doctors and the nurses and the techs and all of that. But there are so many positions that we are trying to find qualified candidates for in so many areas. And I think sometimes we just create our own barriers, unfortunately.
Yeah, you're almost running a small city, right? You need food service, you need housekeeping, you need security, you need one of everything. So yes, the nursing shortage and the doctors, that's one thing. But how are you filling all those other roles where credentials aren't the barrier? What else is getting in the way?
So really what I've seen in healthcare, my organization included, is a lot of times we're asking for certain education levels or certain credentials that aren't necessarily needed for roles, right? I get a lot of times we get job descriptions who say, we need a master's of healthcare. And then really you look at the job description and the job duties and they're going to be doing data entry. We don't really need that, right? And let's talk about, the information technology world. It is growing so fast and so furious that, a lot of times we're asking for bachelor's degrees in, technology, or we're asking for specific certifications. But we've got a whole workforce that has grown up in the technology industry with the changes that are so rapid, that have so much practical experience, that I think sometimes that outweighs what the paper shows that they can do. And so when we put those parameters in, we are basically taking out a pool of talent that we would otherwise, that would be so valuable to our organization. And then I think the other part is that we need to provide opportunities for, people who don't have opportunities to get traditional education pathways, right? So there's so much talent out there, but we don't all have the same access to further education. So one of the things that we've done that we're really proud of, and we're looking to expand it, is we're working with our local community college, and we're actually hiring people from the communities that we serve to come in and go through a medical assistant program. And working with our community college, we pay them to be a student, to go through this expedited program.
Wow.
Yes. And so our partner, our junior college partner, they are doing the classroom work. we provide the clinical rotation, and then after the 10 weeks, they graduate, they pass, they have a certification, they're eligible to go work anywhere that they want. We want to retain them, and we've done a great job of doing that. But we're opening opportunities for these community members to start a career in healthcare, right? But there's so many barriers that if we didn't remove some of those barriers, they would never have had that opportunity otherwise. And so I think that that's one great example of things that, organizations need to be doing, healthcare or not, to bring forward great talent that otherwise we might miss.
Yeah, I love it. It sounds like you've eliminated the sort of structural barrier of having in the job requirement, you must have this. And then you've also solved the problem of having to do the training entirely yourself by partnering with a community college that's already set up to do education. And you're creating the talent that's short. So you've solved a lot of it without probably spending a whole lot of money, right? It doesn't sound like this is a big budget project for you.
It's not a big budget project, and it's no different than, having vacancies, right? So we are having a continued pipeline that we can fill vacancies. And so the savings that we are producing by having a continuous pipeline has been tremendous for us. And again, what a great opportunity to provide this. And, a lot of people have barriers. They may have the access to go to school, but then if they have to go do clinical rotations while they're working, how do you balance work and then these other requirements? If you've got a rent to pay, you've got a car payment, you've got other obligations. And so we are literally saying, we want you to focus in on this to start your career with us. And I think that that's one of the best programs that we've implemented so far. We're looking at implementing another program here very soon with another pathway. And then we're also looking about how we can expand that out.
Wow. And are you doing it just for medical services right now? As I mentioned, you were hiring across the board for lots of specialties.
Yeah. So right now we are focusing on some of our higher need clinical facing positions. But again, like I said earlier, we need to really rethink what we're doing in our job descriptions and what we're asking for. We need to sit down and have critical thinking about, is a bachelor's degree needed for this role, for these skills? Is this something that we can take someone who is bright, who is talented, who may or may not have work experience, and can we train them on the job to do this, right? Or is there something specific that, the bachelor's degree would have provided that they may or may not need? And so you kind of got to balance that out. And I think there's so many roles, if you look within our organization and other organizations, where we can remove those barriers and we don't have to require, a bachelor's or a master's. And we should just have the bare minimum. What are the skills needed?
Right. And how do you sort of suss those out when you get applications? And one of the things, everyone's sort of just groaning under right now is with all the AI-powered applications and the easy apply, that they're just getting tons of unfiltered applications. While that sounds great to have a lot of applications, they're often from people who don't even know they've applied, or they've applied so haphazardly they haven't really thought it through. I can't believe you're overstaffed and your recruiting group. How do they go through and figure out, where is there this talent? Where is there this potential in someone who may not have all the boxes checked?
No, that's a great point. So what we've done is we've put in, our standard screening questions. So as an example, if you're going to apply for an RN position, do you have an RN license? No, you're automatically, put over here. And so again, do you meet the minimum qualifications of the role? No, then you're put into a bucket. But what we do is we capitalize two different ways. So our team members, we still keep the people part, the human part, and looking at those applications and saying, okay, these are the ones that meet the qualifications. These are the ones that exceed the qualifications. We push those through, but the ones that meet the qualifications, they may also meet qualifications for other roles. And so our talent advisors work across the system so that they're able to flex and be able to say, hey, maybe this will fit. And then they spend time, for those that don't meet the qualifications, they still spend time to go back in and look at them to say, you don't meet the minimum qualifications for here, but again, where can we flex? And it may not be the right position for you, but at least let's open up the opportunities and have a conversation around that.
I love it. Rather than spending even more money advertising yet another job, you're sitting on a database of applicants who at least know who you are, have some intent to work with you, and fitting those. It's time consuming, no doubt.
It
Um,
is.
but at the end of the day, if you make the matches, and how's it working for you? Are you seeing it in your retention numbers, or you're seeing it in your offer accept numbers? How are you measuring this?
Yeah, so we're definitely looking at offer accepted. And so, I mean, I definitely think that the talent advisors that we have are doing a fantastic job. And we've got a lot of initiatives lined up to be able to just continue the great work that they're currently doing. And part of that is, manager education. Let's really start thinking about what does a realistic job description look like to make the process even easier. I'm sorry, how can we spread our talent around so that we're spending the quality time looking at the qualified applicants for the roles, but then looking for the qualified applicants or the applicants that come in that are going to be qualified for other roles and spending that quality time having a quick conversation with them to understand. And then the last thing, we're also looking at using an AI interview tool, not as a replacement for any people part of it, but to do a lot of that screening up front where someone can get into the computer application at a time that benefits them, where they're in a room where they can concentrate, and then they can answer the questions in real time, and it's recorded. And it's no different than having a conversation with a recruiter. And then they're able to use that to help parse it out even further, which is, I think, a great time saver for our team members. They're going to ask the same questions that they would ask anyway. And then this way, we're not trying to play phone tag with these candidates who are trying to work and let me call you back, or I need to do it after hours. So we're trying to leverage a lot of different modalities and how we can keep in contact with these candidates.
And it's not a one solution fits everything, right?
No.
It'll depend on the level, the type of job, all of that. I love it.
Absolutely, absolutely. But for some of these, high turn positions or some of these other positions, I think that that's a great way for a candidate to really get across the skills and the qualities that they would bring to the role that you aren't going to see on paper, and then to be able to have that follow-up conversation. But the most important thing is that through the talent acquisition process, you cannot take the human touch out of it. There has to be people involved at every turn.
Yeah. And particularly for healthcare, the kind of candidates you want to attract are going to respond to a human face, voice, all of that.
Yeah.
I think it's particularly important for you. Jeannie, I could talk to you a lot about this. I'm sure other people would like to hear more about it, but I want to be respectful of your time and everyone else's. If people are interested in continuing the conversation, are you open to people reaching out to you on LinkedIn or other means?
Yes, absolutely. I'm on LinkedIn. They can find me. I'm happy to have a conversation and connect with anybody.
Great. Wonderful. Thank you so much. Appreciate the time. Thanks.
Thank
Bye-bye.